right. Hi, everyone. I just wanted to take a minute to introduce you to Allyson. Allyson is a speech-language pathologist who is certified in the Stone Tongue Thrust Protocol. And she is kind of unique in that she was part of the original certification group. So she was exposed to the STTP prior to actually taking the training and becoming certified. And she works currently in a pediatric private practice. Is that right,
Yes.
Allyson? And so we have communicated on occasion about the benefits of her using the STTP in her clinical practice as one of her tools. And I just asked her if she would mind sharing her experience with y'all. So we're going to put it out there for the whole world to see. So thank you, Allyson, for agreeing to share your experience with people who might be kind of thinking about the STTP, but not really understanding how it might be a useful tool for them in their practice. So would you mind, maybe we'll start there, sharing with me or sharing with us how it was different, how it changed your clinical practice being certified as opposed to just knowing the STTP.
Well, I had been exposed to a few of the more commonly known, I would say, tongue thrust programs, and I had used them a little bit. One of my big things was they're a little bit slower. I felt like it took me a long time to feel like they no longer used the tongue thrust, did the reverse swallow. And then I was exposed in a previous clinic to the STTP, but I wasn't formally trained on it, and I basically understood what I was doing, but after being trained, I realized how slow I was to remedy the swallow. Once being formally trained, I'm much more effective, a lot faster. I know exactly what I'm doing and why I'm doing it, and if I see something that isn't following the exact schedule, that I can go back and look exactly what is the problem, refer to my notes, refer to the handout, and fix it quickly. And I'm blown away by how much faster and more efficient I can be being formally trained.
Awesome. And I just brought over the STTP2 for Allyson because there have been some changes since the initial, and we were just off camera talking about some of the changes in our population and how thrusting and the masseter activation, thrusting's more common and the masseter activation is less common, I've noticed in the last 5 years. So that's one of the big changes with the STTP too. So Allyson, I'm curious, how the tongue thrust is a small niche, and so unless you are a specialized provider such as myself, who that's pretty much all I do is tongue thrust clients, but in most private practices it's just a small portion. Did you find value with the STTP training and your certification across your skill set, across other populations you treat, and if so, maybe would you mind sharing a little bit of that?
I absolutely do think it was worth it. It is a small niche, but I use it across populations. The STTP is, you're supposed to be 8 or older to use it, and sometimes I'll get a child that I know, I mean, I can see that he thrusts, but he's not gonna benefit from the formal entire sequence of the program, so I will use some of the different techniques to see if I can just get their tongue to move back a little bit farther, or just activate some of those posterior muscles that they haven't been using, hoping maybe it would, I mean, I don't know that it would clear on its own. I haven't ever seen that with just the partial use, but some of working with it to help with different speech sounds, S's, Z's, R's, K's, G's, and that every speech therapist sees articulation kiddos. That's a huge bulk of my caseload is speech sound kids. And then where I work at Kaleidoscope, almost all of us have been trained, and it's really nice that we can talk, refer to our training, and we can bounce ideas off each other. And I know that they are also using the different techniques, not just with tongue thrust kids.
Thanks. Yeah, so that's been some feedback I've gotten from other clinicians as well, is that even though they use the protocol specifically to eliminate tongue thrust, some of the underlying skills and just the perspective that you have they find beneficial across, like you said, K's, G's, R's, S's. That's interesting that you say that, because that's exactly what I've heard. So thank you. Is there anything else that you would maybe share with someone who isn't sure if it's a fit for their practice, or isn't sure if they really need the certification, the specialized training, or if they can just grab something off the shelf and apply it and get the same result?
I personally feel that it's essential to be an effective speech language pathologist to address speech sound disorders as well as your swallow. If I have a kid that comes in that can't say his R and the back of his tongue is not strong enough to create the sound, I can practice R all day and he's probably not gonna get it. So the first thing I do if I have an R kid, one of the very first things I do is look at to check for a tongue thrust. I have him do one of the exercises that is in the protocol, and if they can't keep their tongue tip off the bottom of their teeth and off their lip, then I will kind of delve in farther and do a little bit more assessment using the STTP, and often I find, yes, you do tongue thrust, you do not have the strength to swallow correctly, and your production of R is greatly impacted by that. So I will step back, treat the tongue thrust, and then proceed with R, and I found it to be much more efficient. R is hard, as we all know. We all are like, oh, R. But it's much easier if I can get the tongue thrust fixed, and they have the strength, and they know they can do it. I can just get it up there, get their tongue up where it needs to be, and it's so much easier for me after I've been formally trained in tongue thrust therapy.
Awesome. Thank you, Allyson. I appreciate you taking the time and sharing that information. And if anybody has any questions, you can reach us at the stonetonguethrustprotocol.com. You can do /training center or STTP training center, and that is where you can find the information about the coursework. Thank you so much for joining us.